Imagine buying a brand new phone. It looks perfect on the outside, but the battery is damaged and it dies in minutes. That's exactly what can happen with sperm. They look normal under the microscope, but either the environment is toxic or the DNA inside is already broken. That's what these two tests uncover. That's exactly what happens in infertility, when sperm looks normal under the microscope. But deep inside, its DNA is broken. This is where the DNA fragmentation test comes in. So what is DNA fragmentation? DNA fragmentation simply means the DNA inside the sperm is broken into pieces. Think of DNA like a string of pearls. If the string breaks, pearls scatter. The sperm might look healthy, but its genetic information is damaged, leading to problems with fertilization, embryo development, or miscarriage. Now, why does DNA fragmentation matter? Poor embryo development. The sperm carries broken instructions. Recurrent pregnancy loss. Failed IVF ICSI despite good-looking sperm. Unexplained infertility when everything else looks normal. Now what's the causes of DNA fragmentation? Why does sperm DNA get damaged? Oxidative stress, smoking, pollution, infections. Varicocele, overheating testis, DNA damage. Age, older sperm, more breaks. High fever, illness. Chemotherapy, radiation, toxins. How do we test it? There are several lab methods to measure DNA fragmentation. ICSI, Sperm Chromatin Structure Assay, uses flow cytometry. Tunal assay, detects DNA breaks directly. Comet assay, DNA looks like a comet tail under the microscope. SCD, Sperm Chromatin Dispersion. Halo test, sperm with intact DNA form a halo. Fragmented ones don't. Can we fix it? Yes, some causes are reversible. Lifestyle changes, quit smoking, reduce stress, diet, exercise. Treat varicocele, surgery can reduce fragmentation. Antioxidants, vitamin C, E, CoQ10, zinc. Use testicular sperm for ICSI. They often have lower fragmentation than ejaculated sperm. So remember, sperm can look perfect under the microscope, but still carry broken DNA inside. The DNA fragmentation test helps us uncover this hidden problem. Now, some of you may be asking, wait, fragmentation test looks at DNA damage, but what about the reason why DNA gets damaged in the first place? That's where the OxiSperm test comes in. Think of it as checking the fire alarm in the sperm factory, while DNA fragmentation is checking if the building has already burned down. Picture this, a couple with unexplained infertility. The man smokes, semen analysis looks fine. Step 1. You do an OxiSperm test. Shows high oxidative stress. You advise antioxidants, lifestyle changes, maybe varicocele repair. Step 2. Months later, if pregnancy still doesn't happen, you run a DNA fragmentation test. Confirms the sperm DNA is already broken. Then you plan IVF ICSI or use testicular sperm. So let's compare the OxiSperm test with the DNA fragmentation test. The OxiSperm test measures oxidative stress in semen. That means it detects the risk of sperm damage before it actually happens. We use it mainly as a screening tool in men with risk factors such as smoking, varicocele, or infection. It's usually cheaper and more available. The DNA fragmentation test measures the sperm's DNA directly. It tells us if the DNA is already broken, the damage that has already occurred. We use it to confirm problems with DNA integrity, especially in cases of unexplained infertility, recurrent miscarriages, or repeated IVF and ICSI failures. This test is more specialized and less widely available. In short, OxiSperm detects risk before damage. DNA fragmentation shows the damage already present.